thank you, doctor, for taking time on your busy schedule to meet with me. I know you've got a lot going on, but there's something that I'm excited to talk to you about today and show you. So, as being an osteologic employee, we've had a long history of bringing you quality products within our Stryker family, but also have selectively carried ancillary product lines that have been very beneficial not only to your practice but also to the patients you treat. We have recently paired up with a company called Trainingvideoceterix1 to expand that product offering, and I'm pretty excited to share with you these two innovative products that I have here with me today. So you may or may not have heard of Trainingvideoceterix. They've been around for a while now. What Trainingvideoceterix is a company specifically designed to treat meniscal tears. The company was started and founded by a practicing orthopedic surgeon who wanted to have a device and a means to treat meniscal tears in ways that we hadn't been able to address in the past. I'm sure in your practice you've come across tears and patterns on young patients that you would have liked to have treated, but unfortunately didn't have a means to or a good method to do that, and as a result would have to do a meniscectomy and remove the meniscus. Now, I know you have a sports medicine practice, but also are involved with total joints, and you have a deep understanding of how catastrophic the removal of the meniscus can be because of the benefit it has in a healthy functioning knee as far as cushioning the joint and providing and helping with range of motion and stability. I know you also know that if we remove the meniscus, that it speeds up the cascade of the disease of osteoarthritis, eventually leading to a lot of pain for the patient and the high possibility of needing a total joint arthroplasty. So there currently are a few products out there in ways that you can treat meniscal tears. The Fast Fix by Smith & Nephew, which has been a good option and a good product, and a couple others. However, I'm excited to show you the NovaStitch and the NovaCut by Trainingvideoceterix. So if you want to step in here a little bit, I'll show you the suture passer. So you're probably familiar with needle delivery devices, and there's some exciting things about this that allow it to function properly every time and also maintain a low profile that will facilitate entry into the joint. So right away, looking at this device, you notice kind of the curved lip, and you can tell right away that that seems to mimic the superior edge of the meniscus and would fit real nice against that. We can also see that it's extremely low profile. Now this is different than, say, a scorpion passer or any other needle delivery devices that are out there on the market. So if you're trying to get entry into that joint, you have the ability to make this very low profile and protect the valuable cartilage and condyles and get access safely to the joint and to these different tear patterns. In the past also, with the Fast Fix, if the tear pattern did involve the junction between the meniscus and the capsule, the Fast Fix wasn't necessarily an outstanding option, and it left you with an inability to treat some of the other tear patterns, a radial tear pattern, a horizontal, or a vertical tear pattern. What this allows you to do is deliver suture exactly where you need it to give you the ability to address all those various tear patterns. So like I said, there's some very innovative qualities to this needle delivery device. We've already addressed the ability to contour the superior edge of the meniscus, and the thing that I think is kind of exciting about it is the retractable lower jaw. So you have the ability to get back to the meniscus and then deploy the lower jaw, and this keeps it very low profile. This is also retractable also when we get to the point of exiting the device from the joint line. Now, if you want to move in here a little bit, I can show you how we load this too. So what we can do is we extend that jaw out, and then we load the device on there, And at this point, we can move the needle forward. Now, one other thing I want to show you that differentiates this device is it has the ability to, in one motion, retrieve the suture with us. So if we get close in here, we can see when I'll deliver the needle here without it. So we can see it delivers that needle, and there's a retrieval piece here in the lip that will grab the suture. So you can see when I deliver that needle, it goes through that lip. Now, as we're looking at this device in conjunction with the knee, you'll notice that that needle is delivered away from the posterior condyle. Some of the competitive systems out there that aren't designed for meniscal repairs will fire that needle straight up. Now, two things can happen in that instance. One, we could ding the posterior condyles and inadvertently create damage to that articular surface. The second, more catastrophic thing that can happen is these instruments, whether it's ours or another company's, aren't invincible. If you jam that needle into bone, there's a chance that that metal piece could break off. And if we're in that posterior tissue, it could get lost and we won't know where it is and cause all sorts of problems for the patient. So there is a lot of benefit to being able to control where that needle goes and also retrieve the suture. So say we're in a case, we've opened the device, we want to load it now. It's real easy to load. So we get the suture into that lower jaw, then we're going to advance that needle about 1 millimeter and collect it into the teeth there, that little hook that we had. And at this point, we can retract that jaw. So now we're loaded and ready to go. I have some meniscus here that we can give this a try on. So, like I said, we can independently control this upper lip and deliver the grasper to the area that we want to stitch and treat any type of meniscal tear we want. One other feature that you may be wondering at this point is, how can I tell where I'm going to deliver the needle and deliver that stitch? If we turn our attention to the top here, we'll also notice that there's a little etching, and that's going to approximate where that needle gets delivered through the meniscus. So we can get access to the meniscus. At this point, we can deploy that lower jaw, like I said. So now we've minimally invasively got access to the meniscus and where we want it. And at this point now, we can start to figure out where we want to deliver that suture. At that point, I'll close the jaw with the orange handle, and I've got a grasp of my tissue. Now with steady pressure, I will deliver the needle with the gray handle and let it fire back, and at this point, pull the suture back out. So that's as easy as it gets. And at this point now, we've gotten a stitch delivered exactly where we want, and we can go and tie our knot and get that down where we want, and there we go. So at this point, I want to show you the other product that they have, the NovaCut. So we've already done this much work to address the tear, tie our knots. The last thing we want to do is cut the knots that we just tied. We also don't want to leave a long tail to potentially create irritation from having a tall knot stack with a tail. So this slick device gives us the ability to side load the suture. So we have the ability to, it's going to be a little bit challenging to see, but we're going to move over this button here, which is going to allow us to load the suture. So we'll go ahead, grab our limb of suture, get it loaded. Now at that point we're loaded. I can freely run this down to the joint, and if I want, I can go ahead and use this also to tighten up my knots. And then once I get it where I want, all I have to do is move this forward, cut the knot. I've now got a nice short knot tail. I'm not worried about cutting my bundle of knots, and I know I've been able to repair a meniscus for this patient that I otherwise couldn't. They're going to be able to heal, recover, and have a healthy, functioning joint for a long time to come. So now I know you are excited to give this a try, and I know you're busy to get back to your clinic and your patients. So I'm going to let you do that, and I'm going to step out, talk to your scheduler, and see when your next scope is, and I will have this available for you.